Hi, I'm Jenny Shand. I'm an associate professor at UCL in health services and population research. And I've been working with the BEST team over the last 6 months to think about life after the trial. So, how do we evaluate the implementation of BEST? How do we support it to be sustained in the sites where it's already been, but also look at how do we scale it to other areas so that ultimately all children across schools get access to the intervention?
How can we kind of make interventions in schools more evidence-based and less kind of based on these trends that we keep seeing?
I think there's a couple of bits to that. The first is to make evidence more accessible.
Mm.
So, a lot of the time, we are embodied in universities in detailed research articles, and we're on top of what does the latest evidence say. But that's not always accessible to people who are working in frontline teams or in schools themselves. So, making that evidence accessible, what works for who, how, and why is really important. Secondly, there's lots of areas where there isn't evidence yet.
Mm.
So if we are going to jump onto a fad, let's make sure that we listen and learn as we do so. So that speaks to evaluation, which is a big part of my academic work, is how do we evaluate what's happening? Does it work? How? Why? For whom? And then also ongoing monitoring. So even if something is evidence-based, circumstances can
Yeah, of
change. So
course.
let's make sure we stay on top of that. Let's keep monitoring the outcomes and see what changes and why, so that we can ensure we're continuing to contribute to the evidence rather than just leaving it as a static piece.
Brilliant. So when we're thinking about kind of challenges that the best team can overcome, what kind of challenges do you think they have to overcome in terms of kind of scaling up into other regions of the UK?
Yeah, I think some of those pieces are about capacity to engage, and that's both the schools themselves. So, how do we encourage schools that this is a really helpful intervention that it can make their students' lives thrive and be better? How do we help them to see what it needs from them in order for it to happen? And as we recruit schools and schools participate, how do we make sure there's not any bias or imbalance of that, so that all schools are participating rather than some opting out because of potentially capacity, worries about, how do we fit this into the school week, etc. Secondly, how do we make sure that the children get access,
Mm.
that everyone can participate? The BEST trial was a self-referral model. So it's really looking at self-consent of those 16 to 18-year-olds to say, yes, I want to participate. And that takes something in itself. So how do we be aware of some of that hesitancy? What are those barriers of stigma, of confidence that might mean that some children that need it the most aren't coming forwards? And then there's also the piece about the capacity to deliver it. So as we scale it up, who's going to train the people who are running the Discover workshops? How do we make sure they stay consistently good and that they are able to really deliver the outputs that we've seen in the trial outside of a trial environment?
I've heard a lot about how kind of advisory groups, people with lived experience, teenagers were used to actually co-design the Discover workshops and in this trial in general. What do you think about co-design and having advisory groups and participating?
I think it's huge. And I think we've
Mm.
moved from engagement, involvement to really talking about co production. And that's more than just co design, it's like throughout the life course of a program, how do we make sure that the people that we want to benefit are there from the beginning, that it's based on what their needs are, that it's accessible in a way that's acceptable to them, but also exciting to participate. And I think what we can learn from those different voices is just so powerful. We all come with our own professional lenses, be that a researcher, a service provider, a clinical professional, a school teacher. And what we need to do is to recognise actually how might this be perceived by others. And I think in terms of this, when you've got a self-referral model, you need to make sure that the opportunities of the workshops are seen and heard by the children that need it. And they're the ones that will know what they'll respond to, rather than sort of very complicated clinical or research language. It's really important that, it's their voice that they see.